Knock, knock. I'm washing my hands. Do I have your permission to film this video today?
Sure.
Great. How should I address you?
Kevin.
Hi, Kevin. I'm Laura. I'll be the nurse practitioner student performing your musculoskeletal exam today. Can you just first tell me where we are right now?
In the living room.
Okay. And what year is it?
2025.
Okay, great. And on a scale of 0 to 10, are you having any pain today?
No, 0.
Okay, great. We're going to start your exam by first just checking for any TMJ in your jaw. So I'm going to feel this joint here as you open and close your mouth. Great. And can you move your lower jaw from side to side? Great. I don't feel any popping or clicking, no signs of TMJ. I'm just going to have you clench your teeth and I'm going to feel your masseter muscles. Nice and strong. Any pain with that?
Nope.
Great. And then I'm just going to have you stand up so I can inspect your spine. And I'm going to take a look here. The patient's posture is upright, symmetric. I don't see any redness, swelling. As I feel down your spine, is there any tenderness or pain?
Nope.
And the spine appears symmetric, midline. I don't see any deviations or curves. I'm just going to have you bend forward at the waist without bending your knees. Touch your toes, perfect. If you come back up, we are going to have you bend backwards. And this is all checking your thoracic and lumbar spine. And then if you can lean to each side, perfect. And then if you can twist to each side. Perfect. And we're going to check your cervical spine. I'm going to have you tilt your chin to your chest. And then bring your chin up to the sky. Bring your ear to your shoulder. And on the other side. Perfect. And then if you can just turn your head to each shoulder. Perfect. And we're going to repeat that to test your strength of your cervical spine. So down. Great. Back, shoulder, great, and this way, great, and then you can turn towards me, and turn. Strength is good in the cervical spine. Next, I'm going to inspect the upper extremities. The arms are symmetric. I don't see any evidence of muscular hypertrophy or atrophy. I am just going to feel down the arms to the hands. There's no sign of crepitus, warmth, or swelling. Any pain?
Nope.
Great. We are going to check the range of motion with your shoulders. So I'm going to have you raise your arms up above your head. Great. And bring them down. And then bring them back behind you. Okay. And can you laterally raise your arms? Great. And can you, with your elbows bent, bring your hands to the back of your hips and then the back of your head. Great. And then I'm going to check the strength of your shoulders. So I'm just going to have you shrug your shoulders up as I press down. Great. Strengthen the shoulders is wonderful. 5 out of 5. And then I'm going to have you flex at the elbows. Flex up and down. And then with your elbows bent to 90 degrees, can you flip-flop your hands? Great. And then I'm just going to check the strength. I'm going to have you raise your arms up. Great. And push them down. Great. And then I'm going to check your wrists and your hand range of motion. So I'm going to have you bend your fingers up and down. And then can you spread your fingers wide apart? And can you touch each thumb to your fingertip? Great. And then can you make a fist? And then I'm going to test your strength by having you grip my 2 fingers. Perfect. Nice and strong. And then I am going to have you take a seat. We're going to test your superficial pain. So I have a sharp and a dull side of a paper clip here. I'll have you close your eyes and tell me if you feel a sharp or dull sensation.
Sharp. Sharp. Dull. Sharp. Dull. Dull.
Perfect. And then we're going to check your reflexes and your biceps reflex. Okay. And the triceps reflex. And the brachioradialis. Great. And on the other side, the biceps reflex and triceps and brachioradialis. Great. And then I'm just going to check the capillary refill in each hand. Capillary refill is nice and brisk. Moving on to your lower extremities, we're going to check your hips. So I'm going to have you lie down on the couch here. And first, I'm just going to have you straight leg lift off the couch, great, and down on the other side. Perfect. And then I'm going to have you bring your knee to your chest. Wonderful. On the other side. Great. And then if you can bring your foot to a flat position with your knee bent on the couch. If you can rotate your hip out and then all the way in. And on the other side. And in. Perfect. And then can you make a figure 4 across your leg while one leg is bent, the other is straight. Perfect. And on the other side. Great. And then we're going to test your strength, and we're going to repeat that straight leg raise, and I'm going to apply some pressure. Perfect. And then you can sit back up for me. Stand rather. We're going to check your knee. So if from standing on one foot, if you can just bend each knee. Perfect. Great. And then I'll have you sit for me. And I'm going to have you flex and bring your knee out straight. Wonderful. And on the other side. And we're going to repeat that with some resistance. Great. Great. And then moving on to your feet and ankles. So if you can flex your ankles and point your toes up for me. And then putting your toes down. And then if you can rotate each foot outward, do them one at a time, and then rotate in. Perfect. A little bit of limited range of motion in the ankles there. We're going to have you stand up so we can check your feet. The feet are symmetric. We have all 10 toes. The Achilles feel nice and strong. Muscle tone is good. There's no hypertrophy or atrophy in the lower extremities. The arches appear as expected. They're not flat nor high. And then can you point your toes up? And other foot. Great. And then can you roll your ankle out and in? Perfect. On the other side. And then you can have a seat again for me. And I'm just going to have you press down on my hand like it's a gas pedal. Okay, on the other side. And then pull your toes up and up. Great. We're going to repeat the superficial pain with the dull and sharp sensation on your lower extremities. So close your eyes. Is the sharp or dull?
Sharp. 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 Dull.
Okay.
Sharp. Sharp. Dull. Dull.
Okay, great. I'm going to check your reflexes in your patella and your Achilles. Okay. Great. And then your Achilles. And the capillary refill in the toes is also nice and brisk. And that concludes our exam today. Do you have any questions?
No.
Thank you.